Hi, I'm Olivia, I'm 15 and I live in Rotherwick. I go to Farnborough Hill School and I enjoy biology, chemistry and drama. I hope to study sciences at university. I also have cystic fibrosis, an inherited condition that affects over 9,000 people in the UK. I frequently come to the hospital for appointments and sometimes stays on the inpatient ward for IV antibiotics. Today I'm going to take you on a tour around Charlie's Day Unit, CDU for short, which is the Children's Day Assessment Unit here at Basingstoke and North Hampshire Hospital. It was one of the first day assessment units of its type in the UK and now helps over 7,000 North Hampshire children and young people each year spend less time in hospital by enabling them to be seen and treated promptly. Children attend with a whole variety of medical needs, referred through their GP, nurse or as a self-referral for help with a chronic condition. With the support of the Children's Community Nursing Team and a direct contact number to the unit for further advice, many children are discharged home and cared for by their families following assessment and implementation of a treatment plan. Okay, let's go have a look around the unit and I'll introduce you to some of the staff that work here. Here we are in the reception area of Charlie's Day Unit. It is here that when you come you need to let the receptionist know you have arrived. This is Philippa, one of the ward clerks here on CDU. So Philippa, can you let us know a little bit more about your role here on CDU?
Yep, I welcome mum and dads with their children, show them to their appropriate bed spaces and admit the children.
If you're very unwell, you might come to the triage room, which is here on the left of reception. Triage is the assessment process of finding out the order of emergency treatment needed based on the severity of your condition. Once you have been assessed and the correct treatment is underway, you may remain on CDU for further observations and then discharged home. Or if you need closer observation and monitoring, you might be admitted to the children's ward for ongoing care. This is the blood room. This is where blood tests are taken. Blood tests have a wide range of uses and one of the most common types of medical tests. This is because a blood test can be used to determine your general state of health, confirm the presence of a bacterial or viral infection, and also see how well certain organs such as the liver and kidneys are functioning.
We do a lot of blood tests here on Charlie's Day Unit. Children are referred in from the GPs, the consultants refer children from their outpatient clinics, and obviously the children who are attending Charlie's Day Unit often need blood tests as well. We can do up to probably 15 blood tests in a day.
When you are unwell and come to CDU, you will be shown to an observation bay where the medical and nursing teams can monitor you. This is Lorraine. She's an advanced nurse practitioner. Can you tell me what an advanced practitioner is and your role here on CDU?
My role in CDU is to look after the sick children who come in. I don't attend to one particular patient, I tend to work across the floor. My role sits between being a doctor and a nurse.
Who can patients and parents speak to about any concerns they might have?
This is a really important question because sometimes I think parents and families think that they're coming to another GP appointment, and what they need to realise is this is a hospital appointment and it is an observation unit too, so they may be here for a little longer than they anticipated, and that's important to communicate with the parents.
Are patients and parents involved in decision making of any care and treatment provided?
We do try to discuss from the minute that the parents arrive with their children what will happen to them, and if there's anything that they particularly feel strongly about. So for example, if it was really inconvenient that a child had to stay in hospital to have antibiotics, we would hopefully be able to arrange a community nurse for them to go home to do that.
Since CDU opened, there has been an increase in the number of children attending, from 3,191 in 1999 to 6,954 in 2009. That's a steady increase of 300 plus children per year. With the government's drive to help care for children at home, the number of children accessing CDU for assessment and then being discharged home is likely to increase. There are two observation bays here on CDU. This bay is mainly used for young people and those undergoing cancer treatment. This is Dr. Julia Shaw. She's one of the consultants here at the hospital and she's also the lead for paediatric oncology services. She's here with the Hunter family. How will young people benefit from these improved facilities?
Both the younger and the older children will benefit from improved facilities. The older children especially at the moment have no privacy, and therefore if we have an area that's set aside especially for them, they will benefit from seclusion and also age appropriate information.
Why is the CDU appeal important to oncology patients who come to CDU?
CDU is the point of contact for all our patients. They get to know the staff here very well, and all the day case treatment is based here. William and his family have known the services and get to know all the nursing staff very well. We see them regularly to give chemotherapy and also the other treatment we offer.
How will young people benefit from these improved conditions?
I think both the younger children and the older teenagers will benefit from the improved facilities that we hope to offer. It's important for children of any age who are suffering from cancer, who are having treatment, that they're kept away from other people with infectious conditions. Therefore, that area is essential in their management.
CDU is now looking to expand its important children's care area to ensure that it meets the needs of every single child in its catchment area. That includes an individual waiting area for cancer patients and a quiet room, and a teenage waiting area and private consultation room. The Child Health team have started a fundraising campaign to raise funds for the new facilities and equipment. Many fundraising events have been undertaken and more are underway. They range from coffee mornings to cake sales, to sporting events to parachute jumps. For more information on how you can fundraise for us, please email cdu@bnhft.nhs.uk.